This is Impact Healthcare.
Attention. This podcast has been disrupted.
Welcome to this extremely special podcast, the Impact Healthcare Podcast, the last episode of the Impact Healthcare Podcast. No, we are not going away. We are evolving. To tease this out a little bit, we've launched a new brand, a new strategy that goes beyond just impacting healthcare. What we've noticed along the journey is impact is a strong word, but not as strong as maybe what we're trying to do. So I wanted to take a blast in the past and go through a journey. We started the Impact Healthcare Podcast on April 21st of 2021. I'll tell you, as a fairly confident public speaker, and quite honestly, I always joke around that say I am an inch wide and a mile deep. I don't know a lot about a lot of things, but insurance, health benefits is something that I really do pride myself at being a student of the game. My degree is in risk management and insurance. I've been in the benefit space since day one, and I've been selling self-funded health plans my entire career. We've done 76 episodes. The Impact Healthcare Podcast, the slogan is the people and strategies that are impacting health benefits. And so we've gone right down the middle. There's plenty of strategies around podcasts, right? A lot of people will tell you interview your ICP, your ideal client profile, and the more you interview them, they get to hear you. You get to engage in a conversation with them, and down the road, you probably could sell them something. We didn't take that approach, and not because I don't think that approach is valid. Quite honestly, I just think that for us, it was always about education. The reason, the absolute choke point of health benefits innovation is lack of knowledge, lack of education. And it's because so many employers have advisors that simply are just tunnel visioned. They're going down the same road. And this podcast was hopefully intending to do three things. Number one, get more health benefits advisors comfortable with the talk track, the strategy, the rising tide lifting all boats. If we could educate people who then educate people who then educate people, the entire community, the entire movement starts to make headway, starts to make progress. So that was number one. Number two is getting employers to have a platform where they could listen to something, hopefully unbiased. We don't have sponsors. We don't get paid for this. We don't try to sell. We just try to give. And we just try to give on the basis of if you hear the strategy and you hear the points and the talk tracks and you start comparing it to what it is that you're doing, and hopefully you hear somebody who's fairly well articulated in the space, that you start to get more comfortable with the subject. And quite honestly, the third is giving a platform for people who might not have as big of an audience, or, quite honestly, doing a podcast is scary. I'll get on stage, I'll jump out of a plane. I don't have a lot of fears. This is one area I can very vulnerably say that I had a significant, and still do have a significant amount of imposter syndrome. And so Along the way, we have had nearly 10,000 total plays. We get about 75 downloads an episode. I don't know if that's good or not. Quite honestly, I don't do it for the stats. I've received calls. We've got all 5-star comments. And I've received calls and do business with people who said they found me through the podcast. And so people are getting educated. We're writing and expanding our business because of it. So we're going to continue to do it. Most of our listeners, nearly almost 70% are female, which I thought was interesting because this is such a male dominated industry. So, ladies, thank you. And gentlemen, stop being so prideful that you don't want to necessarily learn. We're only giving. I can't stress that enough. 75% of the listeners are between the ages of 35 and 59. That kind of made sense. That's our industry. And the two biggest platforms are Apple Podcasts and Spotify. So the type of guests that we've had employers. So we have had some of our clients, we have had some of our advisors' clients, we have had some of our service provider partner clients. We've had clients, and I believe he was my first episode. That first real episode, Dylan Phelps, who's one of our clients from Pittsburgh Tank and Tower. And Dylan is the chief wellness officer and continues to just drive innovation. Um, PTTG, an ESOP organization, is spending about $1 million less than they were in healthcare 5 years ago and have improved the benefits for everybody involved. So think about that. 5 years later, their trend is going down. They're paying less in healthcare, $1 million, probably 30% less. And they continue to improve the benefits for their employees, which again, in an ESOP is huge. We've had big clients. We've had small clients. Carmi from Amy's Kitchen. We've had Sepa, who was an amazing guest talking about how they started their strategy about healthcare design with their advisor, Ed Legande, really trying to match what they're doing with benefits around the life cycle of their employees. So somebody who is just out of college has different needs in their benefits than somebody who is thinking about retirement. We've had some of the industry's most innovative advisors, David Contorno, probably, one that we've all learned something from, Josh Butler, Ben Connor, Emma Fox. I remember talking with Brandon Weber, who was one of the co-founders of Nava, just advisors from coast to coast, big to small, all with the same goal, impacting healthcare. Uh, we've had industry influencers, and I've received an award, for being an industry influencer, but these people are like in a whole nother stratosphere. We've had Dave Chase, who, I continue to be in awe about the journey he's taking with Health Rosetta. Wendell Potter, who, was the right-hand person for the senior leadership at Cigna, helping, promote what he calls the propaganda around consumer-driven healthcare, kind of, saying, hey, what they were doing, what we were doing, because he was a part of at a big organization, and I was a part of it as a big advisor, spreading the propaganda that, high deductible health plans is actually a good thing, which I think for the most part, we could all say that the average consumer having to delay the dollars coming out of the health plan side is just not feasible for the average person who's making $50,000. It's just not. Spencer Smith, somebody, again, who I really admire and obviously look up to his capability of sharing and giving. Um, Jessica Brooks Wood, a just trailblazer who has done it on the employer side and now leading NABIB on the advisor side, giving a voice to everybody. And, I would be remiss if I didn't talk about my relationship and just admiration for Marshall Allen. I pour one out for my homie. Just a man who did it for all the right reasons. I still go back and watch some of our video conversations. He and I would have conversations on Saturday mornings about how we could collaborate. And, Marshall, there's not a day goes by where this industry doesn't miss you. Your wife and your team continues to drive your legacy and the impact that you're having. And you are the epitome of why we do this podcast to just spread the word. So love you, buddy. And we think about you all the time. We've launched, industry type of events, and, kind of promoted them. I was part of helping the Rosen team launch Rosen Health, where more employers could tap into the things that Rosen Hotels and Resorts have been doing. Another shout out to the late Mr. Harris Rosen, one of my business idols, and somebody who woke up every day wanting to impact healthcare. We've talked about the impact of the Consolidated Appropriations Act, the CAA, which I hate that it doesn't get as much publicity, but we've had Pat Moore, we've had Julie Selesnik, we've had people talking about how the CAA is a tool that more employers and more advisors should be using and leading with to get the data, to do all the right things to drive transparency. We've talked about and highlighted many industry strategies from I remember an episode with Omar from ClaimsDoc talking about RBP and how they approach it and their Paved the Way program. We've talked ad nauseum about RX strategies. I mean, the lowest hanging fruit. We've had Gary Becker from Script Sourcing talking about how if we just focus on the expensive drugs, we can help plan members and drive significant savings for employers and their employees. We've had Anthony Masato from Drexy. We've had Rachel Strauss, the PBM princess. We've had a lot of the PBMs on talking about things. We've talked advocacy, steerage, nursing. Nurse Deb has been a guest of ours, and I actually interview her very shortly for one of the first episodes of our new brand, because I just believe that if we hold the patient's hand and give them a reason, a pathway to being a better healthcare consumer, they will do it. And in the current model, there just isn't the case. So we've talked about advocacy with Nurse Deb. We've talked about imaging with Dr. Dickerson and what Green Imaging is doing. And the reality of it is, if there's a healthcare provider, let's call it an imaging center, and they want patients and we got patients, then what are we talking about? Why are we having to go through the farmer to get to the cow? And so we've talked about that. We've talked about transparency and reporting. Hugh O'Toole, Dean Jargo. I mean, we've had some industry I think I'm a pretty big nerd in this industry and love it. There has been some guests where I get off, I'm like, I don't know half of what they know. We've talked about advanced primary care. We've talked about on-site, near-site clinics. People One Health, Jordan, the CEO there, who's been recognized and got funding from Google Ventures. I mean, the reality of it is bringing healthcare closer to the people who need it and making it easier to access healthcare is just such a smart strategy. We've talked about direct primary care and had Dr. Kroll on there talking about how he's helping patients all around Florida stop having to pay the stupid copay and getting it out of the insurance system and bringing it into a model where we're aligning incentives between the provider, the doc, and the patient for the outcomes that everybody wants, which is getting healthier. We've talked about captives. We've had Phil on from talking and really enlightening us about the differences between a group captive and a single parent captive. We've talked about MSK and Mark Testa was on talking about Regenex and how, I don't know, why don't we do something to prevent the big claim from happening that's going to be way better for the patient? Newsflash, that might actually be a great strategy. I mean, duh. The things that we take for granted in the rest of parts of our lives with prevention and doing the right things and helping people is finally starting to make a headway here in the health benefits world. And one of the subjects, last but certainly not least, that I just love talking with, as somebody who thinks that men are way too prideful at times to talk about this, but mental health. And we've had John Troutman on with Mind Club talking about, making it easier for people to access mental health benefits and making employers understand that, they as leaders, us as leaders need to go first in this journey. I, for one, told my entire team I was going off the grid and went to the jungles of Colombia to get off the grid and clear my mind and get in touch with the things around my own mental health, that's blocking me from being the best man and human that I could be. And you know uh, these platforms like a podcast and having guests on, it's not about selling something, it's about exposing people to the realities of the reality, which is the definition of insanity. Because we continue to do the same things in this business and as people, and we expect different results, and that's just not the case. We've highlighted industries. We've talked about the value of private equity getting into managing the health benefits cost of their portfolio companies. James Steins from Hauser, Pat Stodden, formerly with Thompson Flanagan, gave us a good correlation about how some of the leading private equity companies are really getting into helping their portfolio companies manage their health benefits expense. The second largest expense could drive a significant amount of not only financial value, but health and productivity and this affinity with an employer. So huge conversations there. We've talked about what tribal entities can do with Cam Cummins and Dr. Nick Heinen. And of recent, and a big area of focus of ours going forward is how do we bring health care and business closer together, and talking about direct contracts, talking about what hospitals are doing to get closer to employers. And, I look back and I am absolutely humbled every time I get a response or get something out there that somebody listened to me blabber or, bringing on a guest. And so I couldn't be more honored, more humbled to have gone through this journey with the Impact Healthcare podcast. And to say I am excited about what is going to happen in the future would be an absolute understatement. We are chasing and changing the way we approach the business to, quite honestly, go deeper with fewer, really areas of focus where we could start digging in deeper. We've changed the way we're doing our go to market strategy with really trying to expose more patients to these strategies, and looking at this from a, hey, you're the one that's consuming healthcare. Maybe we should be educating you about what's possible. So you're going to see some new areas of education and opportunity. And quite honestly, one of the biggest areas that we're thinking about and building the platform for is stopping and thinking that just because somebody has a 215 or 218 license and they're licensed to sell health insurance, that they're the right or even equipped or the most efficient, or I don't know what word I want to use, but our approach in health benefits, where the benefits broker is the complete judge, jury, and executioner for what employers are listening to, quite honestly, isn't necessarily the most efficient in the innovation space. Very rarely are the leaders, the big boys, the ones that have the market share, very rarely are they the organizations that are also going to drive change. And we're seeing that in healthcare tech. We're seeing that in direct primary care. It's not coming from the behemoths. It's coming from people who probably came from the behemoths and says, that's not the right way of doing it. So our future, not only in the Impact Healthcare podcast, but as a person and as an organization, and quite honestly, as the movement we will continue to hopefully push, it's changing. It's changing from just worried about making an impact to getting more aggressive, going deeper with future, changing the way and looking back and asking ourselves what's been working. And more importantly, how do we do more of the things that are working and less of the things that are not working? So, you know, I thank you from the bottom of my heart for a listen, a click, a download, a like, a share, a word of encouragement. Everybody who's ever done that, and thousands of people who took the time to listen. I started this podcast, one, to drive change, but two, to honor my parents. Our story, as a business and as a movement, starts with the understanding that households get into financial ruin um, because of the way the business works. And so I've committed to my two angels up in the sky that I will continue to be a mouthpiece for change. And so here is to many, many episodes of the new brand. And I'll leave it at that from a hinting and teaser. We'll see you in a bit.